think the main aha moment was that we already know what the answers are. I was in a room of people who have tremendous investment personally and professionally into improving palliative end-of-life care in Ontario, and we've had this discussion ongoing for more than a decade. How do we improve it? So the aha moment was, we already know what needs to be done. It's implementation, how to make it stick, how to make it effective. What levers can we either push or pull to make the implementation plans of those strategies that need to have happen effective? So we don't need more thought on high-level strategy. We need to sort of drill down on effective implementation plans with effective levers to make some of these things stick. I'm a health service researcher, so I think from our group's point of view, the key for us is measurement and being able to measure where we're going, the processes of care that are happening to our patients in their journey through the system, and have they arrived? Have they landed at a good place? So defining and measuring what good care looks like at the end of life and what the processes of care that should be, that accompany them through that care episode. Lots of work that can be done in that field. In the meantime, there are other organizations such as those responsible for the education of healthcare professionals, improving the communication and decision-making amongst our clinicians is going to be vital to this process. So putting some teeth into the credentialing and certification, recertification of healthcare professionals so that being educated in and competent in the palliative approach, which includes good communication skills and decision-making skills, could and should be part of the solution. Accountability structures in our healthcare system. When a patient dies, and there's still a family around that patient that is grieving, perhaps even suffering from the poor care, who's accountable for that? Who do we point to in our healthcare system to say, you're accountable for this quality or not so good quality end-of-life care? So looking at the accountability structures in government and in healthcare within the province, within the LHINs, within institutions, to have accountability for performance. And again, leading back to my earlier comment, to have the adequate metrics and measurements to be able to identify that this is good, bad, or ugly care at the end of life. These are some of the key things I think that emerged.